Institutions Task Force, and we're going to talk about anchor institutions and public policy toward just and equitable communities. I'm David Maurrasse of Marga Incorporated and also director of the Anchor Institutions Task Force, and I will be your host during this webinar. And we will be joined by two speakers. One, Kinnard Wright, who is a senior grants specialist at the Department of Housing and Urban Development. And so Kinnard, say hello to everyone.
Hi, everybody.
All right, nice to see you. And Tanisha Jumper, who is the Communications Director, the City of Tacoma, Washington. Please say hello to everyone. All right, you're on mute, Tanisha.
Oh, sorry about that. Good morning. Oh, good morning for me. Good afternoon for most everybody else. Glad to be with you today.
All right, great. And absolutely, good morning and good afternoon and good evening. We know, looking at the list of registrants, that we've got people listening actually from all over the United States as well as outside of the United States. So people are in many different time zones. So it is great to be with all of you and to have this opportunity to speak with you about what we're going to talk about today. This has been a very powerful and challenging time on many levels for us in the field of anchor institutions. We've been experiencing a lot of changes, but anchor institutions have been playing such a vital role in their communities. And this really has inspired us to focus our work on influencing policy in a way that we haven't done before in the Anchor Institutions Task Force. We certainly have a history of doing this, but we're really moving it to another level. So as we look at our session today, I just want to give you a few ground rules before we get deep into our conversation. So please send all of your comments and questions for the panelists using the chat feature. So for those of you who aren't familiar with the chat feature, you can see it at the bottom of your screen, and you can send a chat directly to Sharmila Lawrence, who is a senior consultant at Marga Incorporated. You can also direct technical questions to Kevin Larson and Hassam Mansour, who are both with Marga as well. So if you have any issues about getting in and out or any technical issues related to the webinar, please direct those kinds of questions to them. Please leave your cameras and microphones off throughout the presentation. And please leave your Zoom in full screen to view only the panelists and the slides. So now we will go into the content of our webinar. So if we can go to our next slide. And again, this is the title of our session, Anchor Institutions and Public Policy Toward Just and Equitable Communities. This happens to be the title of a policy brief that we put together, and you will be able to see that if you haven't gotten a chance to see that already, and we'll make sure that you can see the link. But it is the inspiration for this particular webinar. We can go to the next slide. Over the course of the pandemic, the Anchor Institutions Task Force has been gathering examples of ways in which anchor institutions have been responding in their communities. We have actually produced 3 different editions of examples from across the country and outside of the country as well on the range of ways in which anchor institutions have been responding in their community. And we are taking some specific and particular note as it relates to community-centric anchor institutions. These are anchor institutions that particularly meet the needs of underserved populations really on a daily basis. These are the anchor institutions which actually serve underserved populations on a regular basis. And these anchor institutions really face a very particular kind of interdependence with their surrounding communities. And in many ways, that has been truly animated over the course of the pandemic. The Anchor Institutions Task Force, as most of you know, has been promoting the role of anchor institutions in community and economic development since 2009. We really consider ourselves to be an action-oriented learning community. As many of you know, we have historically held an in-person annual conference that was the primary program for the task force. And we, of course, like everyone else, had to readjust over the course of this pandemic. And as we looked at what was happening in communities, we thought it would be very important for us to really bolster our ability to influence policy in a way that provides greater encouragement for anchor institutions to do the kind of crucial work that will absolutely have to be done at the community level over the course of the next several years because of the level of devastation that we have seen. And we really began to put on paper some of our key thoughts about what that might look like. And that is contained in our policy brief. And I'm just going to go over some of the key points within our policy brief. And again, you see this PowerPoint has multiple dimensions covered within it, and you will have access to this particular presentation. So I'm not going to go over every single component of it, but the essence of this is that the pandemic, as you know, it really has disproportionately impacted the most vulnerable populations. Essentially, what we've seen is an exacerbation of inequities that have already existed. So those anchor institutions that were working very closely with those underserved populations basically are seeing now a greater level of vulnerability and devastation in those particular communities at the level of public health, but also economically. And there's a systemic racism component to many of those inequities as well, which has been so crucial and has been especially highlighted because of all that has been going on over the last year as well as it relates to a racial justice movement, which has been growing and has been really pushing for a racial reckoning, particularly as it relates to things like police brutality. But the reality of it all is that the combination of how inequities were being exacerbated during the pandemic, as well as very, very visible instances of police violence, really show the many dimensions in which systemic racism has been manifested. It's in really all facets of life. And so I think a lot of that has really come to fruition and in a very direct way. And anchor institutions have been responding within this context. And it has happened on so many different levels as we think about the pandemic and we think about hospitals and what hospitals have had to do in order to try to meet the incredible needs of local populations that were contracting COVID at disproportionate rates. When we think about vulnerable communities, when we think about the ways in which anchor institutions have made their sites available to distribute food or to provide vaccinations more recently, or to provide sites for testing, the ways in which anchor institutions have made contributions financially in their communities as well, is another important thing to take into account. And anchor institutions making local investments in their communities, as has been experienced throughout the history of the Anchor Institutions Task Force, is something that is not new, and it's something that has been evolving in a very interesting and important way. And one of the reasons the task force exists is because many more anchor institutions are realizing that their ability to make local investments in their communities is actually integral to their core business operations. This is not something that's, quote, ancillary or charitable. This is something that is actually central, and that's important to take into account. As I mentioned before, community-centric anchor institutions really are playing an important role we think about a hospital like SBH Health Systems in the Bronx, which is situated within a community that is very much disproportionately facing the bulk of the challenges as it relates to the pandemic. A largely Black and brown community, disproportionately contracting COVID. And where do they go to receive health services? They go to that hospital that will take people regardless of their ability to pay. And that's where they go to get health services. So if those communities are disproportionately impacted, it's those community-centric hospitals like that one that will play a role. So if we look at a community-centric university like Rutgers University Newark, and we think about a student population that is largely of color and very much including many low-income populations, when the university has to go to a virtual format, suddenly where people live, what kinds of computers they have, access to broadband, all of these kinds of things come into play in a very direct way. And that community-centric anchor institution actually has to meet those needs. So there is something very particular about this. And the reality is that community-centric anchor institutions are most financially vulnerable. So they're in many ways counted on to such a significant degree in the most vulnerable communities, but yet they also have vulnerable budgets themselves as institutions. So the work required is really going to be significant going forward. And the work to rebuild communities is going to have to look at racial inequities and all forms of inequity. We can go to our next slide as we begin to think about a range of policy options. And so I'm not going to go over every single point here on policy options. They very much are reflective of some of the things that I already mentioned. But if we go down further to look at point number 4, how do we find ways to get federal policy aligned with localities on how to leverage anchor institutions? One of the reasons we think anchor institutions are so important in a pandemic like this is because for the most vulnerable populations, if you're affected on a public health level and you're affected economically and you're affected in other ways, it's manifested in place, it's manifested in your local community. And anchor institutions are enduring institutions that remain in their local communities and have a vested interest in serving those particular populations. So we really have to think about how, when we look at federal policy aligning with local policy in order to leverage and harness what anchor institutions can bring to their communities. So that's important. We'll go to the next slide, which gets into our very particular recommendations in our policy brief. And one is a fund for anchor institutions. It is to have one substantial fund that is particularly designed to provide incentives for anchor institutions to collaborate in their communities in the rebuilding and reimagining of their localities in the wake of the pandemic, especially. Thinking about this as a multi-agency partnership and thinking in a cross-sector way. Anchor institutions are in a number of different fields and sectors. We talk a lot about higher education and healthcare, but we can also think about the arts. We can think about many other fields where there are anchor institutions as well, philanthropy, and a variety of different ways in which anchor institutions are represented. And a national community work initiative is another thing that's important. And what we're saying here is looking at how to get anchor institutions really directly involved in the work opportunities that will be required in order to reimagine and rebuild communities in the wake of the pandemic. So there are going to be new forms of employment. And so anchor institutions can play a crucial role in the training and the hiring and the development of these various forms of employment, paid as well as the kinds of voluntary needs that we're going to need to see at the community level as well. And engaging all levels of government, as I mentioned before, so important to think about the national and the local and aligning together. And so the suggestions that we're making as it relates to both the fund and the community work initiative is to really require collaboration across the federal and local governments. So now we will turn to our panelists, and we can remove the slides and we can have an open discussion. So please, Tanisha and Kinnard, open up your videos. So what I'm going to do is ask a few questions of our panelists, and then we're going to also, as I mentioned earlier, collect questions from you in the audience, and I will pose some of those questions. I doubt we'll be able to get to all of them. But the first thing that I would like to do is turn to you, panelists, and get your feedback on the policy brief and the ideas that I just went over. Do these make sense to you? Do they resonate with you? Do they feel in some ways in alignment with what is needed based on your experiences? So you're both in government, and Kinnard, we'll start with you, and you're at the national government level working in HUD, and you've been at HUD for decades now, actually. And
2 decades, I might.
And you've seen our movement grow over the years with anchor institutions. You're really very familiar with how things have evolved. So is this policy brief and the ideas within it in line with where you think we should be?
Well, David, I think that this is a natural progression in the evolution of anchor institutions, which kind of began, and I have to do a little bit of a historical analysis here, with university partnerships, which was kind of, that concept was championed by Ira Huckabee and under the leadership of Mike Stedman with the COPSI program, which I came into government coordinating. And the COPSI program kind of evolved. It was an experiment, and that experiment ended in 2005. And at the end of that experiment, we began to look at least in terms of universities, how universities can impact communities during times of disaster. Kind of started out with Katrina, and we had a program called Universities Rebuilding America Partnerships that were very, very successful, and it was kind of documented in some literature that we put out. And that kind of introduced at least a lot of my federal colleagues to the concepts of partnerships. In terms of the concept of anchors, David will attest that that is evolving, but it has not evolved to in the sense of recognition of anchors as primary delivery options for federal policy in underserved communities. In that regard, I have shared, David, lots of the information that you have sent in terms of what anchors are providing to communities, particularly during this time of pandemic. I provided that to my colleagues, and it's really resonated with them in terms of the depth of involvement on behalf of anchors. So I think the time is right for us to kind of begin to introduce a formalized way of providing anchors with some incentive to continue that work, but that work should be continued kind of in concert with certainly local government and philanthropy and corporate sources as well. So I think that that is a very good way for us to introduce the efficacy of anchors. Not only, I might add, David, and you kind of alluded to this a little bit, not only in terms of pandemics or disasters, but also in terms of looking at some of the fundamental problems that confront underserved communities, like homelessness, affordable housing, employment, particularly employment as it relates to Title III recipients. Title III recipients are folks who are chronically hard to employ, undereducated or what have you. Also in terms of training. And I think the timing is correct, is excellent for this, given, and I'm sure many people are aware that a fund has been created in the this administration's first asking budget of some $443 million for community schools. And I looked at that with great pleasure and anticipation of community schools kind of taking a step forward in that evolution. So I think that my reaction to your piece would be hopeful. And I think that we have lots of work to do in order to introduce the value of anchors to the federal government, because I don't think that that has resonated throughout the federal government. And of course, we work with lots of partners, and thank goodness right now we are working in concert with lots of agencies. HUD is in order to deliver resources to communities. And I'll talk a little bit later about some of the perhaps some delivery mechanisms that we may want to explore as we go forward with this. So I'll get a lot more specific in that regard.
Great, thank you very much, Kinnard. Tanisha, how about you? City of Tacoma's perspective on it.
So I guess what I'll say first is, even before the pandemic, I would say that this paper would have been welcome, this idea. And I say that coming from the perspective of my title is really confusing because my working title is the Director of Communications for the City of Tacoma, but I was actually hired to do, I hear an echo. Can you guys hear that?
I hear an echo as well.
Okay.
Try again.
So I think one of the, when I started the city, I was in charge of the strategic plan. And when I was looking at the objectives of the strategic plan to get more people into livable wage jobs, to increase access to services and skills, my background is in social services. And I was thinking from a government perspective, that's a weird thing for a city to try to implement on their own, that would have to be done in conjunction with the community. And so as I started looking at strategies to achieve the goals of the strategic plan, I ran across some work that AITF had already done about anchor institutions. and started kind of exploring this idea of what if I made them an integral part of the strategic plan in order to accomplish the goals that we wanted to accomplish for the city. And when I first approached, the anchors that, as I understood them to be, the eds and the meds, everybody was really apprehensive about working with the city, because in their history, it was always that the city came to them and said, "This is what we want you to do. Now go do it." There wasn't that collaborative kind of process of looking at problems together, sitting together and kind of working through things together. It was really like, we've got a medical problem. Okay, hospitals, we want you to do this. We've got an education problem. Universities, we want you to do this. We need more green space, parks, make that happen. And it really wasn't that collaborative kind of thing. And so when we started bringing people together, there was a lot of questions about like, well, how are you gonna? Do we have to pay you? Are you gonna pay us? Or how are we gonna do this work together? And in the beginning, I was like, no, we're just gonna spend time together. We're just gonna talk about what you want to accomplish, what the city's trying to accomplish, and we're gonna figure out how we do this together. And it's been, gosh, I think I came to the first conference, maybe 3. I've been here 6. I've been in this position 6 years, so maybe 3, 4 years ago was my first time coming to the conference. And at that point, I had just like got people to agree to come to meetings. Like nobody was doing any work at that point. And I think what I thought was so interesting about the brief is that, as reticent as the partners were to come work with the city was equally confused why I thought that working with the partners was a good idea. And it had never really occurred to them to have a really collaborative relationship. Like, I would say Tacoma is one of the most cooperative cities you could be in. If you need anything from any one of these groups, they will do it quick. Like there's not a lot of arm twisting that you have to do to get people to do work. But there is a kind of reluctance of like people thinking like, this is my problem. I own this problem, and I can't share that responsibility with multiple people. And so the city had never really thought of, wow, we've got this gap. 10 years ago in Tacoma Public Schools, there was a 51% graduation rate. All the people that didn't graduate, they didn't leave Tacoma. They're still there. And there wasn't a real thought of like, we should engage our institutions of higher learning and our hospitals in getting people skilled up so that they can get good livable wage jobs. That never occurred to them. The hospital was saying, I don't have people. The universities were saying, we've got programs we can't get people in. And the city was saying, we've got a lack of, financial stability that's causing problems with the pressures that are coming from Seattle. But none of them were thinking about this as like, this is one problem. It's not 3 separate problems. It's one problem that if you were talking and communicating with each other, you could solve collaboratively. So, but the hard part from the perspective of the city was, where was the money going to come to do this work? Where was the resourcing going to be to pull all of this together? And I think for me, looking at this briefing, this really helps to undergird that, to say, I have basically, I've done it by myself. I've used fellows to help me do it. I think the first time I presented, I had India with me, who was a fellow at the time, who is now moving on to be a city manager in Virginia, which is very exciting. But I did it just out of pure will. And through the connection with you guys, I met Democracy Collaborative. I scraped some money together to get some consulting from them. I worked with them and helped to shape out the plan. But I didn't have the policy kind of direction that said, this is a real option and a road. I basically have built it as we've gone. And I basically took every extra penny I could find in my budget, every extra, like every mid-biennium modification I've asked for. Can I just get $5,000 so I can pay Democracy Collaborative to help us figure this piece out? I've really been reluctant to ask the anchors to invest in it because it's so new. And I really wanted to show that it worked before I asked them. And so if we had resourcing and some opportunities to go out for funding to do some of the work that we wanted to do from the very beginning, we might be further along in our process. And I think what this policy briefing did was take some of the concepts and ideas that we've been wrestling with and figuring out as a collaborative group, as a, as a network. It put it right out there that other cities could tap into it, other people could tap into it, and really kind of teased out some of the issues that would allow us to go farther faster. So.
And thanks, Tanisha. And I'm going to just stay with you for a moment and ask you another question, particularly about the period of the pandemic, the last year and a half or so. Have you seen any change in the nature of your collaboration with anchor institutions? How have the anchor institutions been responding and with your support? Are you working collaboratively? I mean, one of the things I found so interesting about the pandemic is just how important coordination across a city or a county is to navigating a crisis of this magnitude. Just curious about just the real specific reality that you and local anchor institutions face together.
Yeah. So I think that I've felt really great about the work we've been doing and the relationships we've built over the entire period. But I think the pandemic really helped to show just how strong those relationships actually were, and just how well we were able to adjust to things working in connection with each other. So we have our community colleges, our technical college, and 2 universities. We have the 2 hospital systems in the community, the school district, Metro Parks, the Housing Authority, ourselves, and Workforce Central, which is like our kind of our work, I think our OEA kind of hub. And when first it was, when everything shut down, in March, when I think we had a meeting scheduled for 2 weeks. We're like, hey guys, like we understand, like we're all trying to figure out how to get everybody working from home. We're shutting down all our buildings. Do you want to reschedule the meeting? And our partners came back like, no, we need to have the meeting. We need to talk about what everybody's doing. And so we had started talking about, we had identified like, we've got some needs, we have some very specific needs that we're going to start working on some big projects for. And obviously with, the pandemic, we kind of were like, those things need to be put on pause. But what we realized really quickly was like, all right, everybody's going to school from home, but we've got an issue where not enough people have access to Wi-Fi. As a group talking about, okay, what could we do? Community college was like, we have a huge parking lot. We could put our Wi-Fi signal into the parking lot. The city could provide some patrolling and some extra security. We would make that open. We'd open it so that you don't have to have a password, and we could direct people that they could go to the parking lot if they needed to access the internet for work or for school. Okay, cool. We can't figure out how to get seniors food because we don't have a Meals on Wheels, and the city operates the senior centers. And so we don't want to have people coming to the center. Well, the school district was like, well, we're dropping off food in these places. Could you want to make your packs available? We'll pick your packs up. We're like, okay, well, we've got parking people who don't have, we got rid of charging for parking during the beginning of the pandemic. And so we're like, they don't really have work. Okay, we're going to put them in cars and they're going to help with the distribution. And we're going to get all this food out to people. So there was like really specific things that we were able just to roll right into. How are we going to do this? Okay, Metro Parks usually does programming because they run the zoo. They do programming in the school for kids, but now they can't go into the school. Okay, can we film it and then share it on the TVs, on the city's TV station so that kids can have access to it? They can still get the same education. And like we made those shifts so quick because we were in the room together. We were looking for, okay, here are the big problems. And that has rolled into now us identifying that there was an issue with childcare. All 10 agencies had an issue with once childcare shut down, it really impeded our ability to have our workers keep working and working from home with 3 kids and trying to do online school. Like that was just a really big challenge. And so we started brainstorming together how we were going to work on that. Multicare had come up with a really great process of how they had provided some benefits. And so we all looked at that and said, okay, can we all benefit from that? Metro Parks identified some spaces and with the health department, with the housing authority, of where they could run some childcare programs that allowed all the anchors to allow their employees to send their kids there so that everybody could keep working. And we kind of combined funding and helped each other to do that for continuity of services. While that wasn't necessarily outward face towards the community, it allowed all of the institutions that the community was depending on at that point to keep functioning. Then we rolled right into vaccinations and needing volunteers to help with sign up and running and all the stuff for vaccination clinics. We quickly shifted and we started doing that. We all were recruiting for the hospital for volunteers because they needed like a couple thousand volunteers. All the institutions reached out into their own staffs to say, we'll give you time to go help the hospital, but we also were reaching out to our constituents and our groups. So we got that done. There was just a lot of things that as they were coming up, we were just able to respond because we already had the relationships. We already had kind of those mutual focus of, investing local, hiring local, and knew what communities needed the support because we had already identified that for the work that we were doing prior. One of the results of that was in our last, in November, we put together our legislative agenda. We were able to get what was the funding sources and the things that all of our anchors were going to be reliant on to get out of, for recovery. And we were able to incorporate that into our legislative agenda. So when we're lobbying, our people were saying, yes, do this, but don't touch this money for housing because the housing authority really needs it. And this is integral in our ability to do this. Don't look at, we need more money for childcare. We need more money for online technical, like the technical college was having some hard times with being able to continue to do training when they couldn't do it in person. And so it was costing them more money. They were seeing less. But we were able to advocate on behalf of them because we knew how it fit into the whole picture of how we were working together. And I think that would have been individual people asking individually. And there's some other really cool stuff that's happening around racial justice. Our mayor put together a committee of community members that's called Heal the Heart. And one of the first groups they presented to was the Tacoma Anchor Network to talk to these institutions about how were they going to be engaged in the work of racial reconciliation and healing, and what was that role going to be. And we're still working through exactly what role each one is going to play. But rather than that group having to go talk to 20 people, they were able to come do one presentation to one group, ask all the questions, talk to the CEOs, figure out how we're going to heal Tacoma together. So it's been really, really great in really practical ways, but also in some really big policy ways. So
thank you so much for sharing all of that. Such a great illustration of how important anchors are to their communities, but also the real value of creating cross-sector anchor partnerships, government and multiple anchor institutions working together. You laid that groundwork and it really seemed to have come in handy in a major way in a crisis. Kinnard, just curious about your thoughts on the pandemic and what you've seen from HUD's point of view as it relates to the pandemic. What have you seen in HUD's work? And I'll also fast forward a little bit to where you are. I mean, obviously there's a new administration. And so you're kind of at a point where one administration was in place and the pandemic happened, and now a new administration is in place. So I wonder if you could just say a little bit about what you've seen as far as HUD's perspective and how anchors have worked in their communities during the pandemic. And then also, what is your sense of the future as it relates to the new administration that's come into HUD? Do you envision any particular changes coming in that regard?
Well, David, this has been a particularly fraught and busy time, particularly for the federal government, in terms of just trying to respond to communities that are really being terrifically affected by the pandemic. And every piece of legislation that you've seen, the CARES Act and many others, we have tried to find creative ways to direct the resources needed to communities. And we also notice, I might add, how anchors have responded in multiple ways. You know, as Tanisha has kind of illustrated, to kind of provide services to folks in need. I see the federal government beginning to take recognition of this and trying to find other creative ways to get those resources to first local governments, and also increasingly to anchors. And I will kind of expound on some delivery mechanisms that we might want to look at for the future, in terms of kind of incentivizing that kind of relationship with anchors, because I think that now we're beginning to realize that how important anchors are in communities. And for those anchors that are very, very active, which you've mentioned quite a few, we would like to work directly with them through the municipalities in order to get some problems solved.
Thank you very much. Tanisha, I'll turn back to you. From a local perspective, you've kind of shared with us all that you've built locally and how it came to be useful in a very important way during the pandemic. And now, of course, we're going to come to an aftermath of this pandemic. And you know, obviously, once the spread of COVID is not as significant, it doesn't mean that we're really out of a crisis. We're talking about not only a public health crisis, but an economic crisis. We know that there are some real long-term impacts at the community level. And so I don't know the degree to which the city of Tacoma, along with your anchor network, have been planning for the kind of work that you expect to do and what you expect to confront in the next 5, 6, 7 years.
Well, so we thought we were going to be doing recovery about 9 months ago. We started talking about what would that look like, and with all the things we had talked about between, you know, really local procurement, and we'd already started doing some work about looking at how much money we were spending and all of that. And in that conversation, realized quickly, like, obviously restaurants are really struggling. And so we started talking about, okay, how could we really focus on local restaurants and investing in those in terms of like lunches and things, like when those things come back, how would we focus on that? And that was like really at a high level, but before we understood the depths of what this pandemic was going to do to our community. Now we've shifted gears and we're actually working on a project with the National League of Cities. Their jobs in, I'm not going to remember the exact name of the project, but they have a project that's active right now We applied with our anchors and we were selected, and we are working through basically with Workforce Central as kind of as the hub, a skill up skill. Oh gosh, I'm going to say that wrong too. But we're looking at how do we take people, because Tacoma is heavily retail and restaurants. That's one of our largest sectors. And so, a lot of people have been put out of work and displaced. And so how do we get those individuals into school, get them retrained, and get them into the vacant jobs that we have at the hospital systems? And it's going to take our entire network of partners to make that happen. We're going to be targeting people who are in the housing authority, because we also have a huge homeless problem. We can't get people out of the public housing that we have. So we're focusing on the people who are most ready to leave public housing, getting them into school so that they can move out, and then we can have spaces to bring people that are currently in shelter or in homeless into housing. But at the same time, looking at how do we get people to that livable wage. Our rents have been steadily on the increase. We only have about a 2% vacancy in housing. We've got the hospitals talking about funding affordable housing for the first time and thinking about how they make their investments in that. The school district has kind of given an inventory of the properties they have that maybe they won't need long-term, that we could look at redevelopment or creating spaces. So we're just having a whole other level of conversation. So we brought back a consultant that worked with us when Democracy Collaborative was doing, just everybody's had to adjust. So Democracy Collaborative has had to kind of back away from the Anchor Collaboratives network. But one of the people that was working with us closely is a native of Seattle. And so we connected with him, and he's helping us refocus our work so that we can be ready for the pandemic. And our areas are, operational dollars and practices. How are we going to, increase our business practices so that we can hire more people? Investments, what kind of group investments are we going to make around the areas of stabilizing families and getting people to work? Collective policy advocacy. So we're going to have, all of us are going to have collective policy advocacy so that we can be talking the same talk on behalf of the city of Tacoma. And then how are we going to continue that information sharing and mutual support that we learned during the pandemic? And those are all things we're carrying forward and kind of re-looking at and putting some real framework around.
Great, thank you. One point I'd like to make, just a logistical point. If anybody from our audience has a question, please send the question to Sharmila Lawrence, and she will send the question to me to pose to the panelists. Tanisha, I want to stay with you for one more moment here. Just in terms of what advice would you give? I mean, you have gone through a long path of establishing a great linkage, not only with a single anchor institution locally, but with a network. And I don't believe this is as common. Certainly, we're seeing a proliferation of anchor networks, but they're not always as aligned with city government as you. And so I'm just curious as to what would be your guidance, advice for anyone who would like to establish that similar kind of collaboration and alignment, true cross-sector alignment, government and anchor institutions in their city.
Well, I would say for people who work in government who are realizing that we should not and we never should have thought we could solve all problems, even though that's the posture we take sometimes, that you should ask, because most of the anchors have been waiting to have a relationship with government, but have never figured out exactly how to penetrate the way that government works. And so I would say to ask, but then also understand that we have done harm to relationship building in the ways that we go about doing our work. And so you have to be patient. Like, a lot of people have been very impatient with me, like, well, why haven't you guys built something yet? Or why haven't you hired 5,000 people? And it's like, well, I had to make up for hundreds of years of distrust So I think the fact that in 3 years, I've gotten people to continually come back to meetings, to share their master plans, to tell me what they're going to build in the next 5 years, I would say that there's a huge, huge step forward in terms of our relationship with these anchor institutions. So I really think that being patient from the government side about how these groups are going to interact, because they're waiting for you to get all governmenty again. They're waiting for you to like put a tax on it, or, you know, make a penalty if they don't come to the next meeting. And so they're waiting. And so that patience, I would say from the anchor side, I'm not going to pretend like it's not hard, especially if your government's not in the right headspace around it. But I think what you have to do is show them how you can help them meet their goals. And this isn't always about, it's just hard for government when you got all of these people. And I think that's one of the things people don't understand about like how politicians work, how mayors work, how city managers work. They're like, well, this is really important. Well, one, and especially in this last year, I would say it's been more divisive and more difficult in the last, 4 5 years than ever before, because people aren't necessarily honest and open about what they're advocating for or against. And so you'll go to a meeting and more people than ever have shown up. Zoom has made it more accessible than ever for people to come and express their feelings. And so the people who are really for climate change, or really for, fair, market labor, and people who are really, want to do something about homelessness, they're coming in droves. And so you're on a meeting for 3 hours and you hear, 100 testimonies about we got to support people that are homeless. What you don't see is the 700 letters the council member's getting from someone who wouldn't dare come on the mic and say, just get them off my streets. But they'll write that in the letter and send it to the council member. But there's this thing where people are like, but everybody wants you to do it. Everybody doesn't want you to do it. There's not one situation that we're dealing with in the city of Tacoma right now that everybody wants you to do it. We get blasted if we tell people to wear a mask. We get blasted if we show one picture with someone without a mask. It is so contentious that I think for the anchors who really are more aligned with government than they think, maybe sometimes, it's about just sitting down and having the conversation about, we've got this much resource that we can invest in the city that will help you to deal with this part of town, or this population, or single moms, or people who don't have access to after school. And this is why we care about it. And we think this is why it aligns with what you care about. Mm-hmm. And I think you'd be surprised at the response you would get if you approach it that way.
Thank you. And Kinnard, what is your advice for? Well, yeah, go ahead.
Well, my specific problem that we are having at the federal level is we are instituting programs to address problems like the problem of eviction, which is something that I'm working on right now with some colleagues, and that is, how can we, though there is a national moratorium on evictions, not all localities are enforcing that. And so now we are beginning to work with schools of law and others in order to prevent folks from being evicted during the pandemic. And that's just one example of some of the problems that we're having in terms of the national legislation making its way down to the locales. In the case of Tacoma, Tacoma is very, very collaborative and a very special place in many ways. They have done a lot of very innovative things, but not all localities are similarly situated. So therefore, that's one of our dilemmas, and that is we can have federal legislation to address problems, but we just have to get those solutions implemented at the local level, and that's where anchors through their advocacy and also through their actions can be very, very helpful.
Great, thanks. We do have a couple of questions coming now from the audience, and I don't believe we'll get to all of them, but one question is about county government, county level policy. And so obviously we're talking about local level and city, we're talking about federal level. Do either of you have any thoughts on what we should consider at the county level?
So I think for I can speak about Pierce County. Well, I can also speak about Montgomery County and in Ohio, because I worked there for a long time, and I think counties work very differently depending on how they see their county seat, right? So in Montgomery County, Dayton's the county seat. Montgomery County sees themselves very much like they need to be in lockstep with the city of Dayton. And so they are able to collaboratively do a lot of things that help the entire region because they work very closely with it. And I think that relationship got built over time. In Pierce County, it is not quite the same. And we're working on it. We're getting better at relationship, but there is definitely a difference between the county seat and the rural areas. And so you can't partner with them in the same way because, well, not that you can't, how you would go about engaging with them about partnership is going to be different, because what the city of Tacoma needs, that's where the homeless people are showing. Now they're starting to show up in the outside of Tacoma, and people are getting worried now because now they see it more than before. But some of these bigger issues, it doesn't show up the same way around the county. And so the county, that process I was saying about making the case for why this should be an investment is a little bit different and a little bit trickier depending on where you're at, is what I would say. But I think at the end of the day, it's the same argument. Government has this view of what they need to get done. And if you can't speak to that view, partnering with them is going to be a little bit harder. And so I would say, really understanding where your politicians are and understanding what goals they're trying to accomplish and how you fit into that goal is probably the most important thing for an anchor to do. And for counties, I would just say they've just got to open up their view of how work gets done and realize that as long as we try to hold the purse strings and be the one to get it done, it's always going to be a hit or miss game. So you got to be of your community to serve your community.
Great, thanks for that. Kinnard, any thoughts on that? I also got a specific question for you from the audience. You mentioned collaborative partners. Somebody asked for the distinction between collaborative partners and anchors in the language that you've been using.
Well, in that regard, and that's why I kind of did a historical, kind of talked historically about partnerships versus, not necessarily versus anchors, but collaborative partners were basically teaching folks different, in our case, universities, how to open up their intellectual capital and their many resources to communities. And that's kind of how the partnership effort began. And I think I saw in that chat that the person asking the question kind of related to the fact that partnerships in African-American communities existed for quite some time, and that was, quite out of necessity. There had to be partnerships in order for everyone to basically survive. And, after integration, we kind of lost some of that by virtue of folks kind of, scattering out in terms of where they resided. And the partnership movement kind of captured that once again. In terms of anchors, the anchor movement, which AITF kind of spearheaded, brought the realization that we have anchors in a number of sectors: healthcare, the arts, and education, and many other sectors. So it kind of widened the scope of the fact that these folks are oftentimes the largest employers, largest landowners in these communities, and they have a stake in these communities. So therefore, they are, for the sake of their own well-being, they should be involved with each other and also with the community in a mutual survival mode and in a mutual mode of helping each other to prosper. So I think the partnership movement began with just introducing the concept of partnership, and the anchor movement widened that throughout many sectors of our communities.
Thank you. And I know we're over our time now, so I'm going to thank both of our panelists for your great insights, your perspectives, your experiences, for sharing. Obviously, this is not the end of this conversation in the Anchor Institutions Task Force. We're going to continue to do webinars throughout the year, and we're really at the beginning stages of our policy influence strategy. This policy brief that I mentioned has really been the beginning of this. We've been circulating the policy brief pretty widely. We've been asking members of the Anchor Institutions Task Force, many of you who are listening, for your guidance on who we can talk to. We've had some conversations with legislative staff and other government officials, getting some additional insight from them, some reactions, as we've gotten reactions from the two of you today. So that will continue, and we very much look forward to what can possibly emerge from all of this work. So thanks again to all of you who have joined us, and thank you to Tanisha and Kinnard for a great discussion. Okay, bye everyone.
Thank you for having me.